This is the effects of tourniquet release. When you deflate an extremity tourniquet, you have transient physiologic effects. One effect is that the limb under tourniquet was undergoing anaerobic metabolism, so when you release it, you're going to have a slight metabolic acidosis. Acidosis is caused by a buildup in lactic acid and CO2 in the ischemic tissues. This can cause a slight drop in your systemic arterial pH. The reperfusion of that limb will cause byproduct washout, so that CO2 ends up in the circulation, which can slightly increase your end tidal CO2. There are also vasoactive mediators in the limb, like thromboxane, which can cause a capillary leakage, which can lead to a drop in systemic arterial pressure. This typically resolves with IV fluids, but you might need to use vasopressors briefly. There's also a temperature shift. The limb is usually colder when it's under tourniquet, so when it's released, your blood flows and mixes with that colder limb, leading to a slight drop of less than 1 degree Celsius for your body temperature. So again, these transient changes, slight increase in heart rate maybe by 10 to 15%, secondary to a decrease in your blood pressure. You might have a slight increase in your serum potassium, and you'll have a slight increase in your CO2 levels in the blood.